Winooski's outbreak in early June that spread to Burlington is over. It's no time to celebrate, yet state health experts along with local leaders talked about what worked and what they need to do better. As Local 22's Devin Bates reports, they also provided perspective on how this cluster was contained.
An outbreak is considered resolved following 2 full incubation periods of the virus with no new cases, and for COVID-19 that's 28 days. Dr. Levine said community groups like the Association of Africans Living in Vermont and the U.S. Committee on Refugees and Immigrants were critical in getting the message out as soon as positive test results rolled in.
Their incredible dedication and long hours were not just critical to reaching the people, but importantly, what we learned about delivering culturally and linguistically appropriate information is now a fundamental part of our ongoing outbreak response plans.
The early June outbreak accounted for 117 COVID-19 cases in Vermont and was considered the state's first significant outbreak. Staff with the U.S. Committee on Refugees and Immigrants worked tirelessly on the ground to bring key safety information to immigrant communities with an interpreter on hand. But that was just one piece of a larger strategy.
Worked around the clock to put out videos and voice recordings in 14 different languages. We have a YouTube channel, there's 200 plus videos, as well as being on the ground at those pop-up testing sites and interpreting, providing face-to-face interpretation, which was critical.
The impact of that immediate assistance is seen not only in Vermont's low case rate, but in the day-to-day interactions that might play out differently if collaboration wasn't such a focus.
I was chatting with a family that needed support in understanding isolation. And I could literally, in those moments, send a text message to someone at VDH and say, I need you to explain this scientific site and simplify it. That's how we worked throughout this pandemic.
There were 2 hospitalizations and no deaths in that Winooski outbreak, and the average age of those infected was just 24 years old. Dr. Levine said some of the communication strategies used here have already proved useful elsewhere in the state. In Burlington, Devin Bates, Local 22 News.